My name's Sarah Hurley. I'm an IFBB figure professional as well as a personal trainer, and I'm looking to have breast implants with Dr. Broadway.
I am a figure competitor, and in fitness I get lean, especially through the chest, and I'm hoping that it will augment my shape.
And one of the things that the judges are looking for is balance and symmetry in your physique. And I felt like when I dieted down that was one of the areas that I could improve upon, was to balance out everything in my upper body and create some symmetry.
You know, I don't feel like, I never thought I would be someone that would want breast implants, but throughout the years, as I've gotten more lean and more fit, they've gotten decreasingly smaller, and I just don't feel as feminine.
One of my main concerns was how was I going to be able to maintain my level of fitness.
I'm concerned about the overall outcome, my ability to still be as active as I have been.
I work out 6 days a week, and I needed to be sure that I could continue with that level of fitness with breast augmentation. And after speaking to Dr. David Broadway, I was able to put my fears at rest and know that I can continue with my level of fitness and just enhance my physique.
Well, I think I've decided to go ahead and go under the muscle, and when you work out and you've developed your pectoral muscles, that's one of the fears, is that that might be disrupted somehow. But from all of the research that I've done is that your chest muscles will heal very quickly, and I'll be able to go back into the gym and continue developing my chest muscles.
For the majority of women, I recommend that we put the implant beneath the muscle. And we do that because it typically will look and feel more natural. There's a lower risk for rippling and wrinkling along the upper and also the inside of the chest aspect of the implant itself. It has a lower risk for capsular contracture, which is a hardening of the scar band around the implant, and it makes mammography easier and more reliable as well. So for most women, I do recommend that we put it beneath the muscle. On an occasion, we'll have a lady that does a lot of bench pressing and push-ups, and that aspect of their physical activity is important to them. So we'll need to have a discussion, and we'll weigh the risk versus the benefits. For women that do a lot of work with bench presses and push-ups, those types of activities, I have seen them push their implant down and out over time. So we have to come up with a good solution for that particular patient.
I think I'm going to go over the muscle rather than under the muscle after talking to Nicole and Dr. Broadway. I think the limited sort of ability to use the chest muscles in lifting would probably be difficult for me, as well as I think I need a little more lift, and going over the muscle, just by going over the muscle, it sounds like will give me that lift that I'm looking for.
And I've spoken to other women who've had breast augmentation through Dr. Broadway, and they love it and they feel great. And so it's given me a lot more confidence and calmed my nerves a lot to see the results firsthand.
I'm looking forward to being able to actually buy a bra that fits me and to being able to feel a little more sexy and confident. So
I'm just excited to see the results and to feel more confident about my physique when I step on stage competing against the other girls.